In this lecture, let's discuss about DBT or Dialectical Behavior Therapy. It was developed by Marshall Linhan for individuals that suffer with a wide range of problem behaviors, most notably self-interest behavior, suicide attempts or ideation, eating disorders, those that have undergone trauma or substance abuse, and the purpose behind DBT is to focus on building a balance between acceptance and change. So Marsha noticed if you focus on change all the time, the patients were saying, "We are not being validated enough. You are not understanding what we are going through." And if they focus too much in acceptance, the patients were kind of saying, "Well, aren't you going to tell me how to fix it?" So DBT focuses on a balance of acceptance and change, kind of that dance between validation and working towards developing new behaviors. So DBT is a type of psychotherapy that utilizes a cognitive behavior-based approach. It emphasizes the psychological aspects of treatment. The theory behind the approach is that some people are prone to react in the more intense and out of the ordinary manner towards certain emotional situations, primarily those in romantic, family, and friendship relationships, because our most intense needs are met in those interactions. DBT's main goal is to build the life worth living. That can mean different things for different people. For some, it could be horses or music. For others, it can be soccer or personal growth. DBT is pragmatic. This means that therapists look at target behaviors with the client and create goals to reduce those damaging behaviors. DBT is also a collaborative approach. It is postmodern in that the therapist isn't the expert. It's more like the therapist and the client are in a rowboat together. Without the therapist or the client rowing, the person will just go in circles. Both people need to be going in the same direction towards the personal growth. Now let me tell you, there are 4 main tenets of DBT. The first one is mindfulness. Let's face it, a majority of what ails you is not being able to get out of your own mind. Well, mindfulness skills allow you to put your attention to the present moment and get out of your mind. The main skills associated with mindfulness in DBT are the ability to observe, describe, and to participate. These skills systematically rewrite your brain's negative automatic habitual thinking patterns. The second skill in DBT is interpersonal effectiveness. The main recipients of DBT are supposed to be those diagnosed with BPD, that is borderline personality disorder. These types of people are known for having poor boundaries. This is where the interpersonal effectiveness skills come into play. DBT teaches its client how to assertively ask for their needs and set appropriate boundaries. The third skill is distress tolerance. Most approaches to mental health treatment focus on changing distressful events and circumstances. They pay a little attention to accepting, finding the meaning, or tolerating their distress. This task has been generally tackled by religious and spiritual community and leaders. However, DBT emphasizes learning to bear pain skillfully. 4 sets of crisis survival strategies are taught: distracting, self soothing, improving the moment, and thinking of the pros and cons of a situation. The fourth and final aspect of DBT that helps clients is emotion regulation. People with borderline personality disorder are typically very emotional and intense. They frequently get angry, depressed, or anxious. This suggests that people grappling with these concerns might benefit from helping and learning to regulate their emotions. The main skills of emotional regulation in DBT are learning to properly identify and label your emotions, identify obstacles to changing emotions, reducing your vulnerability to the emotional mind, increasing positive emotional events, increasing mindfulness to current emotions, and taking opposite action, and applying distress tolerance techniques. So this video is just a brief overview of the basics of DBT. In the coming video lectures, we will discuss all of these things in detail. So let's go to the next lecture and learn them one by one. Good luck. In this lecture, let's discuss what is DBT and how does it work. During the late 1970s, Dr. Marsha Linehan was attempting to use the standard cognitive behavior therapy (CBT) to help adult women suffering from suicidal ideation, repeated suicidal attempts, and an increased urge to self-mutilate or self-harm. Trained as a behaviorist, she was more interested in managing discrete behaviors. However, after consulting with colleagues, she finally came to realize that the woman she intended to target met the criteria for borderline personality disorder, that is BPD. During the 70s, cognitive behavior therapy (CBT) received prominence as a beneficial psychotherapy and was used as the mainstay of all the treatment targeting behavioral problems. Linhan was eager to know if this therapy holds high functionality, specifically for people who had developed suicidal tendencies as a coping mechanism against sheer stress and extreme pain. And as she, along with her research team, worked within the boundaries of CBT to help such individuals, lots of problems kept surfacing time after time. They found that CBT was associated with a high withdrawal and dropout rate in the middle of the sessions because of its unrelenting focus on change. The magnitude and severity of the problems that the clients presented with were unexpectedly high. That is, sometimes so much that CBT failed to provide enough time for the therapist to go through the problems faced by their clients and conduct therapy sessions in order to sort them out. So, to tackle these issues, the researchers decided to make some modifications to the standard principles of CBT. They came up with new strategies such as acceptance based interventions and reformulated the basic structure of the treatment. The purpose of these interventions was to give confidence to the patients struggling with social unacceptability and to make them realize that whatever behavior they exhibited, even the ones involving self harm, had a well formed reason. This also helped the therapist learn different ways to teach their clients when to trust their judgments and how to know that whatever they are doing makes sense. In this due course of acceptance, Linhan found another set of strategies, that is, dialectics, that could essentially help these clients even more. And as a DBT therapist, Linhan focused to adopt a dialectical worldview with a strong focus on opposing perspectives. This helped her blend the concept of change in the clients while making them accept their flaws acceptance in a balanced way. This ultimately led to a significant improvement in therapeutic movement, flow, and speed. Beyond the dialectical view, specific strategies used during the sessions prevented the clients from getting stuck in rigid feelings, judgments, thoughts, and behaviors that may occur when emotions are running high. So, in an attempt to help women with BPD, Dr. Linhan finally landed on a DBT, a strategy which is currently helping lots of people suffering from behavior disorders. Dialectical behavior therapy, DBT, which refers to a type of talk therapy, encompasses a cognitive behavior approach, which includes an amalgam of the social factors in harmony with the individual behavior. What makes it different from CBT or any other conventional therapy is that it primarily uses the psychosocial concepts and aspects to help clients transition to a better place in life. The main concept behind DBT is that for some people, the likelihood of reacting intensely towards a certain situation is higher than the others. DBT theory encircles around the fact that the arousal levels of some people under any triggering circumstances may heighten at a much faster pace than a normal person. And due to this reason, it is normal for such people to develop a higher degree of emotional stimulation and require a lot of time before they retouch the baseline levels. Let me tell you, DBT operates on multiple levels simultaneously to help the patient get over their problems. But how does it accomplishes this? The following three features highlight the mechanism through which DBT helps people. First, it is sport-oriented. DBT helps the patients identify their strengths and build on them so that they feel better about themselves and their lives. It is cognitive based. DBT helps the patients identify the beliefs, assumptions, and thoughts that are making their life harder, like, I'm a terrible person if I get angry, and I need to be perfect at everything I do. These are some of the thoughts that may haunt you, making it extremely difficult to live life in a normal way. DBT helps people learn different patterns of thinking and make their life more bearable. In simpler words, it will help you be at peace with yourself and settle on thoughts like there is no need to be perfect at everything, and anger is a normal emotion, everyone experiences it. Okay? Then DBT is collaborative. DBT works on a continuous relationship between clients and staff. In this therapy, the patients are encouraged to sort out their life problems in collaboration with their therapists. It demands the people to role play new methods of interacting with others, finish homework assignments, and rehearse skills like calming yourself when upset. These skills form a crucial part of DBT and are taught to the patients in weekly lectures and homework groups. In this way, individual therapists help their clients master the skills of DBT and apply them to their lives. So, that was an introduction. Now, let's jump to the next lecture and learn more things about DBT. 4 stages of DBT. The treatment with DBT is commonly broken down into 4 levels. The clients are assigned to any of these levels on the basis of the intensity of their behaviors. The therapists are instructed to follow the frame defined in these levels to help the clients. No specific time frame has been allotted to these stages. The therapist and clients are allowed to spend as much time as required depending upon the client's target. So let's learn about level 1. In level 1, the patient is usually miserable and have lost control over themselves. They may be attempting to harm themselves using drugs, or involving themselves in other self-destructive activities. When such clients start DBT, they may compare their experience as equivalent to being in hell. The main goal of this stage is to help move the client from a state of no control to the one where they learn how to get a hold of themselves. Then level 2. During level 2, clients often feel like their lives are filled with desperation. They have a control on their harmful behaviors, but they still suffer, mostly due to invalidation or past trauma. This often continues to an extent that disturbs the emotional experience in such people. The main goal of level 2 is to assist such people to get out of their state of desperation in order to reinstate the emotional experience. The treatment for people suffering from post-traumatic stress disorder, that is known as PTSD, falls into this level. In the coming lectures, we will discuss PTSD in detail. Now let's talk about level 3. In this level, the aim is to motivate the patients to live, find happiness and peace, and build self-respect. The therapist enables the client to live a normal life with moments of both happiness and sadness. Then lastly, level 4. For some clients, an additional 4th level is required in order to familiarize them with the concept of spiritual existence. This stage has been positioned for clients whose life of happiness and sadness does not help them find peace or feel connected to the world. And the main goal of this stage is to assist the client move on from a feeling of incompleteness to a life which grants the clients a capacity to enjoy the feeling of freedom and joy. There are 4 stages and targets in DBT treatment. The 4 stages and targets do not include the pre-treatment phase, which is the phase that every potential DBT client needs to participate in. Once passing through the pre-treatment phase, when the therapist and client determine that they can work together, they typically enter stage 1. Stage 1 is when the therapist and the client work together to get behavior under control, reducing problem behaviors, life-threatening behaviors, therapy-interfering behaviors, and increasing skills-based practice. Let me tell you, the patient will be learning skills in stage 1. It's important to understand that the stages are not chronological. They are actually circular, meaning that there are certain issues in each stage that the therapist and the client may have to work through repeatedly. So it is not uncommon for a patient to finish stage 1, enter stage 2, and then go back to stage 1 again. Now let's talk about stage 2. Stage 2 involves reducing any trauma-related symptoms, including formal diagnosis of post-traumatic stress disorder and other traumatic emotional experiences that may not fit the criteria for PTSD. In addition, invalidating emotional experiences that clients may have experienced when they were in childhood can be discussed here as well. It is important to not turn up the heat in therapy as much until you are in stage 2. I think of stage 2 as turning up the heat because we are processing traumatic histories and intensifying emotion. So, it is essential not to intensify the patient's already difficult emotional experiences from stage 1. So, how you determine the stage that a client is in DBT depends upon the behaviors that they exhibit when they come to treatment. Most often, patients will come to therapy with a tendency to begin in stage 1. They may have self-harm that's present. They may have suicidal behavior or ideation that's significant. They may also have what DBT refers to as significant quality of life interfering behaviors such as substance abuse or very dysregulated romantic relationships, anything that contributes to the difficulties in creating their life worth living. So, if they are exhibiting any of these problem behaviors, then they would begin in stage 1. It's not really possible to have a patient fully resolve all stage 1 behavior prior to moving on to stage 2. However, the most important thing to get under control is the suicidal behaviors and self-harm behaviors. The amount of time that DBT therapist will recommend for having a patient abstain from life-threatening behavior before moving into stage 2 is variable. Patients must have a commitment to abstain from life-threatening behavior prior to moving on to stage 2, and when considering therapy interfering behavior or quality of life interfering behavior, the therapist will want to consider the intensity and frequency of both of those. By the time a client moves into stage 2, they should have an excellent grasp of the skills which are taught in group skills training. For each stage, there are targets which are prioritized depending upon the relevance to the patient's daily behavior and the relevance to the session at hand. So this is a target-based agenda in individual therapy. The targets differ for individual and for group as well as for inter-session contact, such as text messaging the patient, emailing the patient, or calling the patient. Okay, beyond stage 2, the stages 3 and 4 are not as developed as stage 1 and 2 in DBT theory. In fact, not much has been written about stage 3, which involves living life, trusting the self, and reaching individual goals, or stage 4, where the patient obtains deeper meaning through spiritual existence. Most of the work that is done in DBT that has been studied is on stages 1 and 2. So now let's see some key points. Standard DBT includes 4 stages and a pre-treatment phase. All patients begin in pre-treatment. There is no timeline for moving through these stages. The targets differ in each stage. Most patients begin in stage 1, and stage 1 is the most frequently discussed and involves behavioral stabilization. If with life-threatening behaviors, self-harm, or significant therapy-interfering behavior or quality of life interfering behavior, the patient should remain in stage 1. Childhood history and histories of trauma are not addressed until stage 2. And finally, very little information exists for treatment in stage 3 and 4. DBT model. The DBT model is made up of 4 components. Although my professional experience has been that DBT can be provided to clients in an effective way without including all of these components. But the majority of the research on DBT looks at the full model, which includes skills training group, individual group, telephone consultation, and the consultation team. Let's discuss them one by one, starting with skills training group. The skills training group is a psychoeducational structured group format designed to develop and enhance clients' capabilities. The group takes place once weekly and is divided into 4 modules. DBT skills training usually occurs in a group format, run like a class during which group leaders teach behavioral skills and assign homework. The homework helps clients practice using the skills in their everyday lives. Groups meet on a weekly basis and it takes 24 weeks to get through the full skills curriculum. Skills training consists of 4 modules. Mindfulness, that is the practice of being fully aware and present in the moment. Distress tolerance, how to tolerate distressing feelings. Interpersonal effectiveness, how to express one's needs and set boundaries to build healthy relationships. Emotion regulation, how to change emotions that you want to change. Now let's discuss them one by one. First is mindfulness skills. Linhan, the creator of DBT, breaks mindfulness down into smaller parts to make it easier for clients to understand and incorporate it into their lives. The aim of mindfulness is to reduce confusion about the self, and mindfulness is also helpful in many other ways. Increasing self-awareness helps clients become aware of their thoughts, emotions, and urges and gradually learn to manage them more effectively. Through mindfulness, clients also learn to tolerate the thoughts, emotions, and urges that they can't do anything about. Coming to see that internal experiences don't have to be acted upon, but can simply be acknowledged, and that these experiences will gradually dissipate. Then is interpersonal effectiveness skills. These skills aim to help clients reduce the interpersonal chaos that is often present in their lives and are primarily about how to be more assertive. Clients are taught to think about what they most want to get out of an interaction. For example, if they have a specific objective, if they wish to keep or even improve the relationship, or if they wish to keep or improve their self-respect, and then are taught skills that will make it more likely for them to reach this goal. Emotion regulation skills. The goal of this module is to decrease mood lability. Clients are taught general information about emotions, such as why we need them and why we don't want to get rid of them, even though they can be quite painful at times. Clients learn about the connection between their thoughts, feelings, and behaviors, and that by changing one of these, they can have an impact on the others. Distress tolerance skills. These skills are also known as crisis survival skills, and the goal is simply that to help clients survive crises without making things worse by engaging in problem behaviors such as suicide attempts, self-harm, substance abuse, and so on. These skills help clients soothe and distract themselves from the problem, rather than dwelling on it and eventually acting on the urges that accompany the painful emotions. Teaching skills. Teaching skills in a group format as opposed to in individual therapy is done for a variety of reasons. First, clients with emotion regulation difficulties are often moving from one crisis to another, and it's extremely difficult to teach skills in an individual session when the client understandably wants help with the current crisis. In addition, an important aspect of any group setting is validation, as each client has the experience of being in a group with others who have similar problems. Another benefit of groups is that the learning experience can be much richer as each client learns from the experiences of fellow group members. Finally, because interpersonal issues often arise in groups, this can be an excellent arena for practicing the skills being taught and also allows client to receive coaching from the group therapist on how to use the skills to act more effectively. Individual therapy. Now let's discuss individual therapy. Clients usually attend individual sessions with a DBT therapist once weekly. The goal of individual sessions is to help clients use the skills learned in group to reduce target behaviors such as suicide, self-harm, use of substance, and things like that. As with group sessions, individual sessions have a very clear structure and format. DBT, individual therapy, focuses on increasing client motivation and helping clients to apply the skills to challenges and events in their lives. And it runs simultaneously with DBT skills training. Then there is telephone consultation. Telephone consultation is used to coach clients to use skills. Telephone consultation is meant to be a brief interaction to help clients identify what skills might be most helpful in the situation they are facing and to help them overcome obstacles to using these skills and acting effectively. Clients can call their individual therapist between sessions to receive coaching at the times when they need help. So basically, the goal is to coach clients on how to use their DBT skills to effectively cope with difficult situations that arise in their everyday lives. Then lastly, consultation team. According to Linhan, there is no DBT without the team. The makeup of the DBT consultation team will vary depending on the therapist environment. Typically, the team consists of all the therapists in a DBT clinic, that is social workers, psychologists, psychiatrists, and anyone else working in individual therapy and skills training groups with DBT clients. For therapists working in clinic settings, this is fairly straightforward. For those of us who work in private practice, however, it gets a little more complicated because the team is important in keeping therapists on track in their practice. Private therapists may want to develop a team consisting of other private DBT therapists in their area or even online, provided that confidentiality is adhered to. Lastly, I will say the team is used in two ways. First, to provide support to therapists with clients using the DBT module, and second, for case discussion. During case discussion, the team helps the therapist ensure that he or she is adhering to DBT strategies and techniques. The team also addresses any feelings of burnout and ineffectiveness. In consultation meetings, the team uses DBT techniques such as taking a dialectical stance and being non judgmental to prevent team members from getting caught up in power struggles and other dynamics that can disrupt the team and the therapeutic process. So, the DBT consultation team provides critical support to the different team members who provide the various aspects of the DBT treatment, including individual therapists, skills training group leaders, case managers, and others who help treat the client or patient. In this lecture, let's discuss what makes DBT different from other therapies. The world is convinced that DBT can do wonders. But why is it that it continues to work even when gold standard treatments like CBT have failed? In simple words, DBT tends to fill in the gaps left by most of the therapies, including CBT. For example, CBT emphasizes changing the behaviors and thoughts of the targeted people to an extent that the clients are appalled. Most of the therapies targeting problems like stress, anxiety, do not encourage or support their clients to accept where they are right now. They are invalidating to the majority of people who consider concepts such as cognitive distortions to justify their feelings as wrong. That's where DBT differs. DBT promotes acceptance-based behaviors. Dialectical behavior therapy is a form of CBT, but what makes it more successful and unique is its special emphasis on dialectical thinking and mindfulness. Instead of treating the symptoms as problem to be solved, this therapy puts equally focuses on acceptance of experiences by incorporating acceptance-based behaviors. It emphasizes on dialectical thinking. Dialectical means a philosophical stance in which two truths or ideas which seemingly oppose each other exist at the same time. For example, a person coming for help may need to accept where they are right now as well as require motivation to change. In simpler words, while DBT helps people promote the feelings of acceptance, it makes them acknowledge that they have the capacity to bring out more positivity and do much better. This is something that can exclusively be achieved by DBT. And DBT works with emotions. DBT is an in-depth therapy that involves a process of learning cognitive and emotional skills and applying these skills to your life. It helps tackle distressing and difficult emotions and helps you improve the capacity for emotional regulation. And by improving your emotional regulation, you are able to control and express your emotions in a much better way. DBT enhances capabilities with skills training. What makes DBT different than other approaches is that it focuses on improving the capabilities of clients by teaching them different behavioral skills. Skill training is taught in group forms in a classroom setup. A group leader is assigned to every class, whose primary responsibility is to teach different skills through classroom activities, lectures, and take-home assignments. This homework helps the client to pick up the skills they learn in class and to apply them to their daily life experiences. The groups meet every week for about 2.5 hours to discuss the happenings in their daily lives. In order to grasp the full curriculum, an average person requires 24 weeks. Sometimes the program may get repeated to form a 1 year program. Skill training in DBT revolves around 4 different modules, each of which helps the client get stable in their lives. These modules include mindfulness. It refers to the skill which helps you be aware and present in the current moment. Then, distress tolerance. It refers to the skill which helps you tolerate pain in tough conditions instead of changing it. Interpersonal effectiveness. It refers to the skill of asking for whatever you need and learning to say no without compromising on your self-respect and relationships. Emotional regulation. It refers to the skill of changing emotions that you wish to change. But how does acquiring these skills help people? Problematic behaviors occur as a way to manage a situation or resolve a difficult problem. While such behaviors provide a temporary solution or relief on a short-term basis, they are rarely effective in the long run. DBT acknowledges this and assumes that the patients are doing everything in their capacity, but at the same time, they need to acquire new behavioral patterns in relevant contexts. DBT helps such clients develop behavioral skills in the following 4 areas: emotional regulations, distress tolerance, mindfulness, and interpersonal effectiveness. These skills help clients acquire useful ways to navigate situations occurring in everyday life and to tackle challenges. DBT also enhances motivation through individual therapy. DBT is an individual therapy that is focused on improving the client's motivation and help them apply their learned skills to tackle specific events and functions in their lives. It is a unique approach that helps them accept their flaws yet motivates them to get up and do better instead of treating clients like victims that need sympathy. DBT also ensures generalization. DBT includes telephone coaching and other ways of coaching to provide their clients with in-the-moment support. The goal is to coach them on how to use DBT skills to cope with a hard situation arising at any point in their lives. Therapists are available all the time to guide you through a difficult situation, which is something that seldom occurs in other therapy sessions. DBT structures the environment via case management. DBT incorporates case management strategies that help the client manage their own life, including social and physical environments. The therapist apply the same validation, problem solving, and dialectical strategies to enable the client to analyze their problems without any external help. This empowers them to manage their problems on their own with minimal interference by therapist unless when it becomes absolutely necessary. If you are living with an anxiety disorder, you most likely acknowledge that feeling in control of yourself is a validating, valuable feeling. DBT can help you achieve this feeling through group skills training, trained therapists, and skills coaching. All these parts will work together to make sure that DBT offers you skills that you can put into practice
to help you get a full control over how you feel and live. Let me tell you, DBT is currently operating on four different levels: mindfulness, interpersonal effectiveness, distress tolerance, and emotional regulation to help people get over their worst fears and depressive states. The coming video lectures will highlight how four of these components can help you achieve stability in life. So let's move to the next lectures and start learning all about.
In this lecture, let's discuss DBT distress tolerance and mindfulness skills. Now that the concept of DBT is clear, let's move on to discuss the first two components of DBT, that is, mindfulness and distress tolerance, and their role in the treatment of behavioral disorders. What are DBT mindfulness skills? Mindfulness refers to paying attention to what is happening at the moment on purpose. When you are practicing mindfulness, you are focusing your attention on the present experience, noticing whatever is happening at the exact moment, not lost in past or wondering about the future. Mindfulness is actually something entirely opposite to being on automatic pilot. While you are on automatic pilot, you are either doing things out of habit or by rote. For example, many people relate to a condition where they arrive at work but do not really remember the car ride that took you there. That is because you did not have to think about opening the car door, sitting down, putting the key in the ignition, and things like that. You just did all these things automatically and found yourself at your office minutes later. Doing things in an autopilot mode is not bad. It is actually quite useful in a way that it helps save energy and time. Problems begin to rise when you start living most of your life in this mode instead of actually being present in the moment. So, why does mindfulness matter? Mindfulness is like a magic ingredient that helps you control your sentiments and take a step back from intense emotions. When you take a step back and notice what is happening, you are less likely to experience out of control emotions. Mindfulness is powerful. When you use mindfulness to control your attention, you open yourself to a whole new world of choice. You do not need to act and react out of fear, habit, or intense emotions. The benefits of mindfulness have been well researched, especially during the last few years. A regular practice of mindfulness has been shown to decrease distraction, increase emotional regulation, improve anger management, and decrease depression. So now let's discuss mindfulness in DBT. Let me tell you, mindfulness forms the backbone of DBT. It is in fact the first skill taught to the patients opting for DBT. This is because without mindfulness, it is not possible to alter long-standing patterns of acting, thinking, and feeling. Mindfulness is the core skill underlying all other skill sets in DBT. It is central to getting through difficult situations, resolving interpersonal conflicts, and regulating emotions. Mindfulness is also a primary component for assessing your wise mind, an important foundational concept in DBT. Wise mind is said to be the synthesis of a reasonable mind and an emotional mind. Once you find your wise mind, it gets easier to know what's real for you and act according to it. The concept of mindfulness in DBT revolves around two questions: what to do and how to do it. These are known as the what and how skills. In the coming lecture, let's discuss them one by one. In this lecture, let's discuss the what skills. There are three skills that comprise the what of mindfulness. Number 1, observe. Number 2, describe. And number 3, participate. Let's start discussing the observe skill. Observe means noticing any direct sensory experience. It is what you feel, see, taste, sense, hear, and touch without judging it, labeling it, or reacting to it. This is a bit tricky for most of the people at first. That is, your mind wants to label what is happening around you instead of just being with the sensations of an experience. While you practice the observe skills, you are permitting your immediate experience to happen without trying to change it or pushing it away. Like all the skills, observe skill is experiential. This indicates that the intellectual understanding of this skill is not sufficient. You have to experience it for yourself to truly understand it. For example, listening to the sounds around you, just noticing them without passing any comments, is an example of observing skill of mindfulness in DBT. The next skill is describe skill. The describe skills built on the observe skill. While observe is only bare bones attention noticing something without adding a label or a story, describe includes putting the observed experience into words, whether it is an emotion, thought, or a sensation. Sounds like a piece of cake, right? Not quite. The tricky part is that DBT mindfulness demands you to practice the describe skill by sticking to the facts and refraining from any personal assumptions or interpretations. So when you describe an experience, you label thoughts as thoughts, feelings as feelings, and emotions as emotions, only without adding any labels, judgments, concepts, and opinions. The describe skill is an excellent tool to help you not mistake every thought or feeling of yours for a fact. For example, just because you're feeling unlovable doesn't justify it as the truth. The describe skill is also a great tool for reducing reactivity, especially in emotionally sensitive people. It does not let you jump to conclusions without checking the facts, hence saves you from a lot of trouble. The last is the participate skill. In DBT, participate means exactly what it sounds like. It means throwing yourself entirely into an activity and letting go of judgments, fear, and self-conscious instead of sitting aside and watching. Most of the young children exhibit this skill, immersing themselves in play without any sort of inhibition. For example, you can practice this mindfulness skill during everyday activities. For example, washing dishes. Instead of thinking about how much you hate it or planning what you will do once you are finished, you immerse yourself completely in the ongoing activity of washing dishes. Let's discuss the how skills. The purpose of how skills in DBT is to understand how to accomplish the what skills. And you are supposed to practice the 3 what skills. 1. Mindfully. This means giving your full presence in the current situation, not lost in the thoughts of the past or future. It means
Concentrating on one task at a time while focusing on it completely instead of splitting it between things. For example, having a conversation on the phone while cooking a meal. Practicing this skill is important. One mindfulness in DBT helps you open up to the potential beauty hidden in small moments. It prevents you from juggling multiple tasks because multitasking can weaken your connection with the wise mind, therefore, affect your decision making skills. Then, non judgmentally. It is common to notice something and release judgments instantly, either about yourself, like, I'm not good at this, about others, like, he's not good at this, your experience, like, this was indeed a bad idea, or anything else. Most of the youth judge habitually, automatically, and continuously. Judging has become such an important part of our internal dialogue that we fail to notice how judgments can increase emotional pain and potentially destroy relationships. Hence, the how mindfulness skills in DBT require you to do everything non judgmentally. Being non judgmental prevents the emotional charge of the situation from heightening, making it easier to look for solutions. Then, effectively. This skill involves acting effectively, that is, doing what works versus sitting aside and wishing things were different. In DBT, effectively is all about shifting your focus away from the concepts of what's fair and unfair, or who is right or wrong, and focusing on what really works. When you are not concentrated on doing what is effective, you may act in ways that are more about proving a point or being right. Trying to be right gets in the way of getting what you need or want. DBT mindfulness skills. A case example. If you catch yourself critically judging yourself and your actions, mindfulness can help recognize these judgmental thoughts and help discriminate them the reality. That is, what is actually happening in real time. Let's have a look at an example. Imagine you get to work late one day and instantly start judging yourself harshly. It might be common for you to think, I'm such a big loser. There isn't one thing I can do right. What is wrong with me? Thoughts like these can force you to judge yourself harshly. However, it is also a classic mistake to start deeming these thoughts as true and use them to evaluate who you actually are. Thinking harshly about yourself and passing judgmental comments can negatively impact your feelings and behavior. For instance, if you are convinced that you actually are a loser who always tries his best to do the things the right way but fails, you may end up feeling ashamed. You will start avoiding people and never take risks like speaking up in front of others. You will even foresee any brilliant things you accomplish as the feelings of being useless overshadows everything else. Mindfulness encourages you to step aside and take out some time to evaluate what is it that's happening. You are having judgmental thoughts, but you are not defined by these thoughts. With mindfulness, you can label them as just thoughts. As you start practicing mindfulness, these thoughts start losing their impact on your mind and body. In simpler words, these judgmental thoughts are no longer facts. Mindfulness also helps open up the possibility to think about our situation differently. If you're able to take note of your self judgments and can successfully label them as just thoughts, this lets you assess your wise mind, which might say, it is okay to be late for work once in a while. Everybody can get late. It is not the end of the world. And it may even help you figure out different ways to avoid getting into such a situation ever again. Okay?
A mindless exercise. Let me tell you, mindfulness is a skill that requires practice. Most people get distracted, zone out, or spend most of their daily lives being unmindful or running on autopilot. As a result, they then get lost, anxious, and frustrated when a situation doesn't happen as they expect it to. So, now I'm going to tell you some common ways in which all of us have experienced being unmindful. You can see the ones that you have done. Like while driving or traveling, you don't remember the experience or which roads you took. While having a conversation, you suddenly realize that you don't know what the other person is talking about. While having a conversation, you are already thinking about what you are going to say before the other person have even stopped speaking. While reading, you suddenly realize that you have been thinking about something else and have no idea what you just read. Or while walking into a room, you suddenly forget what you came to get. After putting something down, you can't remember where you just put it. Or while taking a shower, you are already planning what you have to do later, and then you forget if you have already washed your hair or some other body part. So, all of these examples are fairly harmless. But for people with overwhelming emotions, being unmindful can often have a devastating effect on their lives. Let me explain it through an example. Consider the example of Lee. Lee thought that everyone at work hated him. One day, a new employee whom Lee found attractive approached him in the cafeteria and asked to sit down. The woman tried to be friendly and make conversation, but Lee was more engaged in the conversation in his own head than he was in the one with the woman. She's probably just stuck up like the rest of them, he thought. Why would someone like her be interested in me anyway? Why would she want to sit with me? It's probably just a joke someone else put her up to. So, from the moment the woman sat down and tried to talk with him, Lee just became angrier and more suspicious. The woman did her best to make small talk. She asked Lee how he liked working at the company, how long he's been there, and she even asked him about the weather. But Lee never noticed. He was so wrapped up in his own conversation and in paying attention to his own self critical thoughts that he never even recognized that the woman was trying to be friendly. After 5 minutes of unsuccessful trying, the woman finally stopped talking to Lee. Then, a few minutes later, she moved to a different table, and when she did, Lee congratulated himself. I knew it, he thought. I knew she wasn't really interested in me. But at the expense of being right, Lee's unmindfulness and self criticism had cost him another opportunity to meet a potential friend. That's why mindfulness skills are important. So, now that you have a better idea of what mindfulness is, it's easy to see why this skill is so important. Let me tell you, there can be many reasons, but I will tell you the most important three reasons. Number one, mindfulness skills will help you focus on one thing at a time in the present moment, and by doing this, you can better control and soothe your overwhelming emotions. Number two, mindfulness will help you learn to identify and separate judgmental thoughts from your experiences. These judgmental thoughts often fuel your overwhelming emotions. And number three, mindfulness will help you develop a skill that's very important in dialectical behavior therapy called wise mind. And wise mind is the ability to make healthy decisions about your life based on both your rational thoughts and your emotions. For example, you have probably noticed that it's often difficult or impossible to make good decisions when your emotions are intense, out of control, or contradict what's rational. Similarly, it's often difficult to make informed decisions when your thoughts are intense, irrational, or contradict how you feel. So, wise mind is a decision making process that balances the reasoning of your thoughts with the needs of your emotions. So, in the next coming lecture, I will tell you about some exercises that will help you become more mindful of your moment to moment experiences. Let's go over there and learn about those exercises. Focus on a single minute. This is the first exercise that will help you focus more fully on the present moment. It's simple to do, but it often has an amazing effect. Its purpose is to help you become more mindful of your own sense of time. For this exercise, you will need a watch with a second hand or preferably a stopwatch. Many people feel that time goes by very quickly. As a result, they are always in a rush to do things or the next thing that could go wrong. Unfortunately, this just makes them more unmindful of what they are doing in the present moment. Other people feel that time goes by very slowly. As a result, they feel like they have more time than they actually do, and they frequently find themselves running late. This simple exercise will help you become more mindful of how quickly or slowly time actually goes by. Instructions. To begin this exercise, find a comfortable place to sit in a room where you won't be disturbed for a few minutes and turn off any distracting sounds. Begin timing yourself with your watch or stopwatch. Then, without counting the seconds or looking at the watch, simply sit wherever you are. When you think that 1 minute has passed, check the watch again or stop the timer. Note how much time really has passed. Did you allow less than a full minute to pass? If so, how long was it? A few seconds, 20 seconds, 40 seconds? If it wasn't a full minute, consider how this affects you. Are you always in a rush to do things because you don't think you have enough time? If so, what does the result of this exercise mean for you? Or did you allow more than a minute to pass? If so, how long was it? 1.5 minutes? 2 minutes? If so, consider how this affects you. Are you frequently late for appointments because you think that you have more time than you really do? If so, what does the result of this exercise mean for you? Let me tell you, whatever your results were, one of the purposes of learning mindfulness skills is to help you develop a more accurate awareness of all your moment to moment experiences, including your perception of time. If you like, return to this exercise in a few weeks after you have been practicing your mindfulness skills and see if your perception of time has changed. Okay, the next exercise is focus on a single object. Focusing on a single object is the second mindfulness skill that will help you concentrate more fully on the present moment. Remember, one of the biggest traps of being unmindful is that your attention wanders from one thing to the next or from one thought to the next, and as a result, you often get lost, distracted, and frustrated. So, this exercise will help you focus your attention on a single object. And the purpose of this exercise is to help you train your mental muscle. This means you will learn to maintain your focus on whatever it is you are observing, and with practice, you will get better at focusing your attention, just like an athlete who exercises certain muscles to become stronger. Doing this exercise, you will eventually become distracted by your thoughts, memories, or other sensations. Let me tell you, that's okay. This happens to everyone who does this exercise. But do your best not to criticize yourself or stop the exercise. Just notice when your mind wanders and return your focus to whatever object you are observing. Pick a small object to focus on. Choose something that can rest on a table, is safe to touch, and is emotionally neutral. It can be anything, such as a pen, a flower, a watch, a ring, a cup, or something similar. Don't choose to focus on something that could hurt you or on a picture of someone you don't like. These will stir up too many emotions for you right now. Find a comfortable place to sit in a room where you won't be disturbed for a few minutes, and put the object on a table in front of you. Turn off any distracting sounds. If you have a stopwatch or an alarm clock, set the timer for 5 minutes. Do this exercise once or twice a day for 2 weeks, choosing a different object to focus on each time. You can photocopy the instructions if you want extra copies to refer to, or you can record the instructions in a slow, even voice on an audio recording device and play them while you are exploring the object. Instructions are: to begin, sit comfortably and take a few slow, deep breaths. Then, without touching the object, begin looking at it and exploring its different surfaces with your eyes. Take your time exploring what it looks like. Then try to imagine the different qualities that the object possesses, like what does the surface of the object look like? Is it shiny or dull? Does it look smooth or rough? Does it look soft or hard? Does it have multiple colors or just one color? What else is unique about the way the object looks? Take your time observing the object. Now hold the object in your hand or reach out and touch the object. Begin noticing the different ways it feels. Is it smooth or is it rough? Is it soft or is it hard? Is it bendable or is it rigid? Does the object have areas that feel different from each other? What does the temperature of the object feel like? If you can hold it in your hand, notice how much it weighs. What else do you notice about the way it feels? Continue exploring the object with both your sight and your sense of touch. Continue to breathe comfortably. When your attention begins to wander, return your focus to the object. Keep on exploring the object until your alarm goes off or until you have fully explored all the qualities of the object. Alright? Now let's go to another exercise. This is the third exercise known as band of light. That will help you focus more fully on the present moment. It will help you become more mindful of the physical sensations in your body. Write down the instructions before beginning the exercise to familiarize yourself with the process. Then you can either keep these instructions near you if you need to refer to them while you are doing the exercise, or you can record them in a slow, even voice on an audio recording device and play them while you are observing the sensations in your body. To begin, find a comfortable place to sit in a room where you won't be disturbed for 10 minutes. Turn off any distracting sounds. Take a few slow, long breaths and then close your eyes. Using your imagination, envision a narrow band of white light circling the top of your head. As this exercise progresses, the band of light will slowly move down your body. And as it does, you will become aware of the different physical sensations you are feeling beneath the band of light. As you continue to breathe with your eyes closed, continue to see the band of white light encircling the top of your head and notice any physical sensations you feel on that part of your body. Perhaps you will notice your scalp tingling or itching. Whatever sensations you notice are okay. Slowly, the band of light begins to descend around your head, passing over the tops of your ears, your eyes, and the top of your nose. As it does, become aware of any sensations you feel there, even small sensations. Notice any muscle tension you may be feeling on the top of your head. As the band of light slowly descends over your nose, mouth, and chin, continue to focus on any physical sensations you might be feeling there. Pay attention to the back of your head where you may be having sensations. Notice any sensations you may be feeling in your mouth, on your tongue, or on your teeth. Continue to watch the band of light in your imagination descend around your neck and notice any feelings in your throat or any muscle tension on the back of your neck. Now the band widens and begins to move down your torso across the width of your shoulders. Notice any sensations, muscle tension, or tingling you might be feeling in your shoulders, upper back, upper arms, and upper chest area. As the band of light continues to descend down around your arms, notice any feelings you are aware in your upper arms, elbows, forearms, wrists, hand, and fingers. Become aware of any tingling, itching, or tension you might be holding in those places. Now become aware of your chest, the middle of your back, the side of your torso, your lower back, and stomach. Again, notice any tension or sensations, no matter how small they might be. As the band continues to move down your lower body, become aware of any sensations in your pelvic region, buttocks, and upper legs. Be sure to pay attention to the backs of your legs and notice any feelings there. Continue to watch the band of light descend around your lower legs, around your calves, feet, and toes. Notice any feeling or tension you are experiencing. Then, as the band of light disappears after completing its descent, take a few more slow, long breaths, and when you feel comfortable, slowly open your eyes and return your focus to the room.